has managed to save thousands of lives in the past 1.5 months. As per today reports, India plans partial lockdown exit to restart its stalled economy. Of course, this will depend upon state to state and hotspot areas. The lockdown should be extended, I think, for more 15 days more.
Okay, thank you very much. Mr. Pankaj Jiswani is also a celebrity singer, but before that, I'll just say hello to Mr. Dr. Jawahar from Uttarakhand. Would you like to say something, Dr. Jawahar? But we can't hear you. It's, I think, a problem somewhere because Dr. Jawahar, we can see you, but we can't hear you. You are unmuted. Okay, so let us take Mr. Pankaj Jiswani. He's one of the friend and he's a singer. He has some song for us, but also not only for Corona, but I would like you to sing something other which is more enthralling, which is equally enthralling. Please go ahead.
Namaskar, Doctor.
Yes, you are clear and loud. Please go ahead.
Okay. सबसे पहले तो आपका धन्यवाद करूँगा कि you join me, allow me to sing for you in a precious meeting. I think this song from Corona also. There is a beautiful message to public masses and it is required. Could you listen to me?
Yes, go ahead. Please go ahead.
Listen to me? Okay, yes. Okay, I'm giving you a song, Corona song. Okay. सौ बातों की एक बात बाहर जाओ ना, सौ बातों की एक बात बाहर जाओ ना, जल्द सुधरेंगे ये हालात बाहर जाओ ना, कितना भी कार्य जरूरी हो तो घर पर बैठ, कितना भी कार्य जरूरी हो बैठो घर पर, दो लक्ष्मण देखा कुछ अपने दर पर, बना लो कर्फ्यू से हालात बाहर जाओ ना, बना लो कर्फ्यू से हालात बाहर जाओ ना, जब तक ना हो पाए आपात बाहर जाओ ना, जल्द सुधरेंगे ये हालात बाहर जाओ ना, जल्द सुधरेंगे ये हालात बाहर जाओ ना। तुझे बोला है सीएम ने, मोदी पीएम ने, तुझे बोला है सीएम ने, मोदी पीएम ने, सबके हित में है जो बात बाहर जाओ ना, जल्द सुधरेंगे ये हालात बाहर जाओ ना, तो बातों की एक बात बाहर जाओ ना, तभी टूटेगी चेन कोरोना वायरस की, तभी टूटे ही ये चेन कोरोना वायरस की, ना इलाज ना दवाई है किसी के बस की, ना इलाज ना दवाई किसी के बस की, सोशल डिस्टेंसिंग हो दिन रात बाहर जाओ ना, सोशल डिस्टेंसिंग हो दिन रात बाहर जाओ ना, मान लो मामूली की बात बाहर जाओ ना, जल्द सुधरेंगे ये हालात बाहर जाओ ना, तो बातों की बात बाहर जाओ ना, कुछ तो सीखो यूएसए चाइना इटली से, कुछ तो सीखो यूएसए चाइना इटली से, हुए बेकाबू से हालात तो की गलती से, हुए बेकाबू से हालात तो की गलती से, छोड़ो फालतू के जज्बात बाहर जाओ ना, छोड़ो फालतू के ये जज्बात बाहर जाओ ना, मिलाओ ना दिल की से हाथ बाहर जाओ ना, जल्द सुधरेंगे ये हालात बाहर जाओ ना, तो बातों की एक बात बाहर जाओ ना, जल्द सुधरेंगे ये हालात बाहर जाओ ना, बाहर जाओ बाहर।
Thank you very much, Pankaj ji. Thank you very much. I will take back another song later on. Please stay with us. In the meantime, Dr. Mohanan is back. There was a question from Dr. Ashokan to CSI. Please ask your question again.
some of the healthcare workers, like say doctors, nurses, are affected. So it's a very important issue. So how to approach, how to tackle this, and how to prevent this? This is my question.
Dr. Mohan, please.
No, very difficult to answer by the cardiologist. We know that at least 10% of the healthcare workers all across the world has been affected by the virus. Unfortunately, we are at the front line, and cardiologists definitely a symptomatic person with LVF, with acute MI, you never know, and then you are subject to all sorts of problems. The paucity of the PPE. Again, I think we had a long discussion with one of the sessions with the Prime Minister and others, and we impressed upon them, including the IMA leaders were there, impressed upon them about the use and the utility of the value of PPE for the healthcare workers. I sincerely hope that we have to look after ourselves. There is no question about that. Safety first is, I think, of course, quality service, but with safety, with personal safety. But as your question is a very difficult one for any association to answer.
Okay, thank you. Please.
CSA has come out with the guidelines how to prevent and what are the precautions needed to take as far as cardiology is concerned. But we don't have a guideline for healthcare workers. That's why I raised that question. Second thing is regarding HCQ. We know that we have to take HCQ as per the ICMR guidelines. Let's say COVID patient, we are taking COVID patient. But we are not sure. Suppose patient comes, asymptomatic patient comes to OP. So in that way, whether all the healthcare workers have to take this case or we have to do the test for all patients. That's not possible. So what is the strategy in this situation?
I think already the ICMR has given a guideline. To supersede that guideline will be difficult. I think every time people are quoting the ICMR guideline. But as somebody said, if there is no cardiovascular involvement and your QT is less than 550, that's what IHSR, the Indian Heart Rhythm Society, has come out with. I think possibly, we will have to give it to your choice, because the ICMR is very categorical, saying that now healthcare professional in contact treating COVID patients.
Okay, thank you. Dr. Mohan, please stay back because we will have somebody. Dr. Johar wants to speak from Dehradun.
Can you hear me now, Dr.
Yeah, I can hear you. Yes, please.
Good evening. You have arranged this seminar very nicely, and we have learned a lot of things. I am a geologist actually. Our Earth is 4,600 million years old. So we have to change, I think, the way we are living. We have crowded our Earth so much and we have overloaded it. We have so many cars. If you open it suddenly now, you see it is so. We have to change our way of living. That means more work from home, like IT sector. We can take from home itself. Why we are rushing? We are going from one part of the country to another. We can stay at home and do productivity for the country.
Thank you very much. I will take Mr. Uttam Singh. Thank you very much, Dr. Johar from Dehradun. I think he has very good, nice. The planet is recovering. That means the planet is recovering from the slot, the things which have been done wrong. But this is not the way. We don't want people to die for this. So, okay, thank you very much. Mr. Uttam Singh Rawat from Paris is our friend, basically from Uttarakhand. Just one message about the corona and what France is having in Paris.
Hello.
Yes, you are very much.
Hello.
Yeah.
Yes, sir, आवाज आ रही है?
Yes, perfectly. Please go ahead.
हेलो, नमस्कार सर, डॉक्टर साहब नमस्कार। सभी वहाँ पे जो जूम मीटिंग में आए हैं सबको मेरा प्रणाम। मैं उत्तम सिंह रावत फ्रांस में हूँ और यहाँ पे कोरोना जो वायरस है वो बहुत कम हो चुका है, काफी है। अब 200-250 लोग डेड हो रहे हैं और गवर्नमेंट ने बहुत सख्ती कर रखी है जो कि भारत में नहीं है। हमारे देश में नहीं, लोग अभी कह रहे मजाक ले रहे हैं वहाँ पे, यहाँ पे बहुत सख्ती है। मैं अभी 14 मार्च से अभी तक सिर्फ 3 बार बाहर गया हूँ। घर के अंदर 2 बच्चे हैं, वाइफ है, मेरी वाइफ इंटर कॉलेज में टीचर है। यहाँ पे हम 3 बार बाहर गए हैं और मेरे ब्रदर जो देहरादून में है वो 40 बार बाहर चले गए हैं। 40 बार बाहर चले गए हैं घर से, बताइए आप।
चलिए, थैंक यू वेरी मच। बताइए आगे।
तो सर यहाँ पे सरकार ने बहुत अच्छी सुविधाएं दे रखी हैं। गवर्नमेंट ने यहाँ पे खाने की, पैसे की, बच्चों को खेलने के लिए सब पैसे दे दिए बच्चों को खेलने के लिए। गवर्नमेंट A to Z यहाँ पे पब्लिक के साथ में है, तो हमको भी गवर्नमेंट के साथ होना चाहिए। और भारत में मंत्री जी के साथ उनको बता दीजिए कि पब्लिक को समझाइए, थोड़ा सा पब्लिक को समझाइए। वहाँ पे लोग मजाक ले रहे हैं, उनको अभी पता नहीं है, अभी 2-3 महीने बाद पता लग जाएगा ये कौन सा वायरस है, ये वायरस कौन सा है। बहुत बहुत वायरस देखे हमने अभी तक, अब का वायरस कभी नहीं देखा। जो यहाँ लोग मेरी खिड़की के सामने मर रहे हैं लोग, मेरे बैक साइड में दो हस्बैंड वाइफ मरे हैं, बिल्कुल पीछे वाली बिल्डिंग में। अपने सामने मौत नजर आ रही है। सर देखिए, इनको समझाइए, इतने कुछ नहीं होता वाले शब्द भूल जाइए सर, जो कहते हैं कुछ नहीं होता है वो शब्द भूल जाइए, सबको बताइए वहाँ पे। धन्यवाद।
Okay, thank you very much, Mr. Uttam Singh Rawat. We have to be very, very careful. George Shiva was attacked. This is here. George Shiva, are you listening to me? Can you put on your video? Would you like to comment something? I think she is not prepared. I think. Okay, so what we'll do, we'll request our friend Mr. Pankaj Jeswani to give one more song for the enthronement before we finish off. It's almost 2 hours. We have been working here. Pankaj Jeswani, are you here? You were just not here.
बिल्कुल।
हाँ बताइए कहाँ आप? I cannot see you actually. I can hear you very well. आवाज आ रही है, बहुत बढ़िया आ रही है आवाज।
आवाज आ रही है?
आ रही, बहुत अच्छी आ रही है।
मैं तो बिल्कुल सहमत हूँ। अभी जो जनाब बता रहे थे, इट इज वेरी सीरियस। अभी जो यहाँ पे भी गवर्नमेंट ने थोड़ा सा लॉकडाउन के वक्त तो नहीं है, जो घर से निकल रहे हैं लोग घर के, तो वही प्रॉब्लम आ जाएगी। थोड़े दिन और हम पेशेंस रख सकते हैं। मेरा भी ये मैसेज है गवर्नमेंट को, थोड़ा सा लॉकडाउन जब है तो प्रॉपर होना चाहिए। वी शुड टेक इट सीरियस।
जयसवाली साहब एक अच्छा सा एक बढ़िया सा गाना गा दीजिए, बिकॉज वी आर ऑल डिप्रेस्ड।
बताइए
कोई किशोर कुमार का गाना दीजिए, कोई किशोर कुमार का गाना, कोई भी किशोर कुमार का,
किशोर जी का गाना,
कोई भी गाना, कोई भी।
हम पर तेरा लहराए, हर रात यादों की बारात ले आए। मैं सांस लेता हूँ तेरी खुशबू आती है, एक महका महका सा पैगाम आती है। तेरे दिल की धड़कन भी तेरे गीत गाती है। पल दिल के पास तुम रहती हो, एवं के पास तुम रहती हो। जीवन के सफर मेरा भी मेरी तेरे बिछड़ जाने को और दे जाते हैं यादें तन्हाई में तड़पाने को। ओ हो ओ हो ओ हो। और सुना तो एक गीत और मेरे दिल के करीब है,
एक और पापा, एक और
इसकी आवश्यकता है।
बिल्कुल बिल्कुल, प्लीज गो अहेड। अभी हम 5 मिनट हैं, 3-4 मिनट। डॉक्टर पीके अशोकन इज देयर एंजॉयिंग द सॉन्ग्स।
ओके सर, मुझे बोलना चाहिए तो मैं गाता हूँ। किसी की मुस्कुराहटों पे हो निहार, किसी का दर्द मिल सके तो ले उधार, किसी के वास्ते हो तेरे दिल में प्यार, दीवारती का नाम है। मानो अपनी जेब से फकीर है, दिल दिया दिल के हम अमीर है। मिटे तो प्यार के लिए वो जिंदगी, जले बाहर के लिए वो जिंदगी। किसी को हो न हो तो ऐतबार, दीवार से का नाम है। एक हसीना थी, एक दीवाना था, क्या उम्र क्या समा क्या ज़माना क्या तुम्हारा प्यार सभी मुझे तुम्हारा प्यार सभी मुझे मुझको बरखड़े दीदार चाहिए तुम्हारा प्यार चाहिए मुझे
हेलो ओके
दिल जो पखेरु होते पिंजरे में न रख लेता दिल जो पखेरु होते पिंजरे में न रख लेता तो जतन से मोती के डाले देता इनमें से अंदर आवे याद न जावे बीते दिनों की जाके ना आए जो दिन दिल क्यों बुलाए उन्हें दिल क्यों बुलाए मेरी भीगी भीगी सी कई पाँव पे रहे जैसे मेरे सपने बिखर के जलमन तेरा भी किसी के मिलन को अनामिका अपनी सर से मेरी भीगी भीगी सी
या डॉक्टर अशोकन थैंक यू वेरी मच पंकज भाई आपने बहुत अच्छा सुनाया बड़ा अच्छा लगा थोड़ा टाइम कम है 2 घंटा हो गया लेकिन वी विल टेक यू बैक नेक्स्ट टाइम इज वन ऑफ द वेरी इंपॉर्टेंट सिंगर पंकज जयसवानी यू कैन सी हिज YouTube and I think the last word before we end from Dr. Ashokan was Mohandas Sahab Dr. Ashokan I think we have to wind up now. I would like to tell you before I finalize because I spoke to Antonio Colombo. He said he got an emergency call. That is why he could not join in because he had agreed yesterday. But unfortunately, because he said next time he will certainly come. The second thing is Dr. Ganga Khedkar is also got busy with the ICMR meeting. He said he will allow somebody else to join. And the Minister Saab says if you continue for another 15-20 minutes, we will be happy to come. But I think it will be too late. It's already... because Mr. Prakash Javadekar said in the morning that I am not expert, I will not come, but the confirmation came from both Mr. Shripad Naik as well as Mr. Ashwini Chaubeji. But unfortunately, they are still got busy with some meeting with Dr. Harshvardhan. So this Corona time is not easy to catch these people. So I think it was a great meeting and with Dr. Greg Stone and ACC, Dr. Deepthi joining us with Dr. Pisira support and other people from the society coming and joining, and we continue to this webinar. But the last word would be from Mansoor Ahmed is trying to join again, but I don't see his picture. I think we have to keep it for the next time. But Shokan, would you please just summarize the whole meeting and then ICR and then we'll take up from finance. Yeah, I can hear you very well. Just summarize.
Yeah, I should manage to get my system going.
Mansoor is back, so we can hear Mr. Dr. Mansoor Ahmed, are you here?
Yeah, can you hear me?
Yeah, thank you so much for coming. Pakistan is live now. So we have Dr. Mansoor Ahmed. I don't know Dr. Ashokan knows him or not because a lot of the people know him in India. So please tell about the Pakistan, what is it doing and how is Corona behaving in your country?
I think I would say, I think looking at the data worldwide, I would say it's a little mystery around here because so far we do not see such a steep rise as we have seen in the rest of the world. Possibly there is a delayed response. There is a likelihood that we lack collecting and do not have a good system of collecting the data. And of course, people are scared of quarantines and that is why they may not be reporting. But having said that, I think there is a disturbing news coming even this afternoon. There was the news about a death of a lady doctor who went to the hospital and within 2 days he died. He tested positive, everything was there, the CT scan, everything confirmed. And moreover, a day before, another friend actually died. So it seems it is on the rise. Our major issue is with the data collection, testing is limited, and lockdown is there, but how many people are actually practicing is very difficult to say. You can still see people on the roads, and there is a lot of problem with educating them. Be it a peon in the hospital, be it the nursing staff, be it the doctor, be it the technician, be it the helper, or whoever. And I think so far I can see there are many more PPEs available. People are well dressed, well covered, but still there may not be enough. As far as we are concerned, I am doing almost negligible elective procedures. I only go for procedure where there is a serious risk of death or serious risk of complications. Otherwise, I'm avoiding that. But doing my clinic, which I have closed down for a long time, I only see people who are in desperate need to see me. And I'm covered partially, not really completely, hoping that my patients are not COVID positive, they do not have any symptoms. But at the same time, I have just recalled 2 patients who actually approached me because they were breathless, a young girl and an old patient of mine. The typical symptoms were there, but then they tested negative and CT test was also negative. So I think in our part of the world, we are seeing a little different type of disease, or rather epidemiology. The disease is just the same, it is still a killer. But I think epidemiologically, it's behaving a little differently. Possibly, it's a slow phenomenon in our society, and let's hope it does not rise as steeply as it has done in the West, because we simply do not have healthcare facilities to cope with that. And we just hope the nation will take care of it before it really hits us. Thank you so much, and many congratulations, Vivek. It's wonderful to see you, wonderful to talk to you, and we'll maintain our friendship. We'll continue to meet and see each other, and of course always join each other's program. And congratulations for such a great webinar.
Thank you,
Thank you so much.
Thank you, Dr. Mansoor. We always feel that Pakistan is our brother, so I have a friendly relationship and brotherly thought process in my heart, I would say. And we have to come together to work together for the prosperity of people, not the politicizing everything.
Well, I think we can only do our job. There are others who are doing their job. But we must stay together, the medical fraternity, the healthcare profession should stay together and help each other.
Yeah, I think it's a big concern, and therefore when I come to Apollo Hospital, so I always feel scared. So I keep on sanitizing my hands at least every minute, or not every minute, every 10 minutes. So
you see, my hands are almost all the time, they're itching with alcohol all the time. I'm using more alcohol in my hands. And of course soap, I'm running out of soap every other day. So, but that's life, I guess. And I can see, I mean, the culture of mask is here to stay for another at least 6 months, if not 1 year. It is here to stay, and I think we should continue using the mask.
I think that will be a good thing to do it, and I completely agree that this coronavirus, COVID-19, is not going to leave us so soon. And there is a possibility that will come back in December when the flu season is there. So we have to keep, I think the whole system of socializing will be going off. Not many parties, because every day you have a party these days. I think webinar will come in, and we will have to be very sure that this nature is different. And I don't know whether you were listening to my talk about when Japanese professor, the Nobel laureate, was speaking something else. But we are not going into the politics, but it's very important that we have to have vaccine. That's very important. But I'm not too sure that vaccine, sometime Dr. Ashokan can further enlighten us. A vaccine will be made for one strain, and that there is a possibility of mutation of this virus. So how it will work for all the strains when it comes back? So it's not clear. Ashokan, would you be talking about this a little? And I think it's too late now, but I will still like Mr. Pankaj Jeswani to speak one song before we finish after Dr. Ashokan speaks. Ashokan, please.
I'm enjoying those. Please. Enjoying the music.
Yeah.
Yes, go on. Another song, please.
Yes. Ashokan, please answer my question about the strain changing of the strain.
The only solution is the vaccination. And we don't know the pattern of the virus, whether it changed the mutation. And a very important thing is we are doing a lot of tests now. The number of tests have increased, but the positive detection rate, each test has come down. That's a very interesting thing. There is a change in disease pattern. We are working since long incubation. Just now, Dr. Mansoor has said, what we are seeing is the change in pattern, more healthcare workers affected. And what we are seeing is low mortality in some of the areas, South Asian countries, almost similar to that of USA. But mortality very high in European countries. We don't know if there is a different in strain and which one is affected. As Professor Gregstone said, maybe some European states, some countries, and other states affected USA and maybe some Asian countries. We don't know. And as Dr. P.P. Mohan has pointed out, we don't know the exact reason why the mortality is not very high when compared with USA.
Mohan, I would like to know your thought process about this. I feel that vaccine is a difficult situation because the strain can change. One vaccine will work throughout the whole life, like BCG is difficult to find out. Dr. Mohan, please.
Same strain is affected in India or other Asian countries. But disease pattern in Asian countries almost same. Just now Dr. Mansoor said Pakistan is also almost same pattern. I think Dr. Mohan is there too.
I'm here. I mean, what that you said, Ashokan?
Yeah. See, the disease pattern in India and Pakistan almost same. And all the Asian countries, if you see, the mortality is not very high. The mortality in India, Asian countries, and the USA same. And there is a difference in the disease pattern of European versus other countries.
Absolutely. Except maybe certain European countries, like Russia is reporting a low incidence. We don't know. Low incidence and low death rates. Comparatively, it is something like 80,000 and 1,000. So, but generally, as you said, the India, Bangladesh, Nepal, Sri Lanka, Pakistan, they're all almost like us only. And that is why the explanation for BCG, the hot climate, came in.
Or possibly our bad habits are keeping us safe.
Less virulent strain here.
Okay, I think I cannot see many people this time because of the poor bandwidth. So let me take Pankaj Jeswani to finish the whole thing, and then I will summarize the meeting. I can see Mansoor. Mansoor, anything else before I take up Mr. Jeswani for the song?
Sorry?
Would you like to comment something else before we take up Mr. Jeswani?
I've learned a lot from this meeting, really, and this exchange of ideas between East and South Asia, between the West and South Asia. But it's really very, very interesting. As Greg Stone said, in certain parts of the US also, mortality was very low, the infectivity rate was very low. Perhaps my own feeling has been that all has to do with a lot has to do with air travel. So wherever you see there is a lot of air travel, the incidence, the prevalence is very high, like in certain in Europe, but in US, New York has very high air travel, whereas in certain states the air travel is very low. That may be one of the reasons. Then public transport. I can see the use of public transport in cosmopolitan West is very, very high, which should have been high in our part of the world also, but what has happened? I see very funny thing like one motorcycle carrying 4 or 5 or 6 people sometimes. That means there is not a mix-up between different groups of people in public transport either. The buses are there, but they're not used as frequently as motorcycles. So I don't know. I mean, that's my guess. Mixing of too many people, too many groups, and air travel. And if we can recall that most of the time it has traveled to our part of the world from air travel already. We had our first case coming from UK, then the cases coming from Saudi Arabia, then cases coming from Iran. That was where we had seen the first incidents. And local transmission came very late actually. It only started about a month ago, not before that. So that may be a possibility. Very long shot. I don't know. I think we'll just have to wait and see.
Thank you. Thank
As
you.
regards presentation, our own expert, I was talking to the other day here, who actually is part of this research about vaccines. They said the samples they have received, there are already 3 strains in Europe only. So how many are going to be, and as somebody actually pointed out, for your vaccine, what sort of vaccine do you make? Is it going to be like a flu vaccine that comes out every year based on the virus available? And vaccines, as you know, is a very dangerous thing. If something goes wrong, really goes wrong with the human body. So we'll just have to wait and see. I'm very intrigued with your anti-parasite drug, really. Can you quote any anecdotal reports on the anti-parasite drug that you said you use over there?
Sorry.
Ivermectin?
Ivermectin is only tested in vitro. I don't know, the government is not working proactively all over the world, because it has shown very clearly in vitro that it can kill the virus within 24 to 48 hours. It is so fast. I don't know which company or which somebody is trying to do a trial on in vivo or not, but I think I will request all the government, including WHO, should try to find out, because ivermectin is the only proven in vitro killer of COVID-19. But it is only in vitro.
Isn't it the drug that is used in cattle?
This is actually anti-parasite drug. It's an anti-parasite drug without major side effects. Cattle, I don't know. This I don't know. Maybe I have to look forward further. Okay. Yeah.
Because I have never used it. Having lived with worms in the society, I never used it. I have never heard physicians prescribing it either. But can somebody...
Because we have a carbamazine, which is also anti-parasite drug, which is hetrazan. So my father was proposing that why not we use and have a trial of 10 days for the COVID-19 is having major, without any serious side effects. So we are requesting the Prime Minister or the Health Ministry to find out some way it can be tested in the patients of COVID-19. My father is a pharmacologist.
It's supposed to be a very safe drug.
Yeah, my father is a pharmacologist and he has worked with ICMR for a long time.
Okay.
He has more than 100 research papers and is still cited in the citation. You can see that a lot of his research is cited. So he's thinking that why not we can test this is a very safe drug. But we have to have a trial which should be approved by the ministry. Either we can try in some patients in Delhi, but we have to have a confirmation from ICMR. I'll contact them and then let us see if it comes out. Because we need a drug which should be completely curing it. There's nothing.
That's good. That's very good.
So let me talk to Mr. Pankaj Jeswani to have one or two songs from his kitty to Anthralas before we finalize this. There's still a lot of people trying to join in between. Few people are leaving. And so Pankaj, please go ahead. Mr. Mansoor Ahmad is live. Naresh Sahu is also from Kuwait, our friend, who is from Indians in France, and who is also just joined with the video. Dr. Johar is still with us. Dr. Ashokan is with us. And please go ahead, Pankaj, to Anthralas to some Kishore Kumar songs or something like that.
And when you are visiting us next, it has to be with you.
Pankaj, we can't hear you.
Yes.
Okay, Pankaj, you are now unmuted. Yes.
ओके सर, आवाज आ रही है?
आ रही है, पूरी आवाज है।
मैंने एक कोरोना में एक गीत और लिखा है कोरोना।
आप मैं रिक्वेस्ट यू वन थिंग, कोरोना बहुत हो गया, प्लीज शो वाले सॉन्ग सुनाइए जो पुराने चल रहे हैं, मजा आएगा उसमें।
चलिए मुझे आपकी फरमाइश दीजिए।
नहीं कोई भी एनीथिंग, किशोर कुमार, राजेश खन्ना सॉन्ग्स
जो आपके दिल से निकले।
ओके ओके ओके, चलिए मैं एक हजार सुनिए, बढ़िया संगीत आपको सुनाता हूँ। हमारे साथ कर तो मुझे बड़ी हेल्प मिल जाती है, क्योंकि मैं चाहता हूँ आपकी फरमाइश में गाऊँ, और मुकेश जी का हो, हेमंत जी का हो, कुछ भी हो, मेरी कोशिश रहती है। तो फिलहाल ये मैं आपको एक मैसेज सुनाता हूँ बढ़िया सा, उसमें सभी सिंगर्स की आवाज़ें आ जाएंगी और दो लाइनें आ जाएंगी, आपको यहाँ पे आ जाएगी।
अच्छा, आपने मुकेश जी का एक पुराना गाना मुझे याद आ गया, आपने कहा मुकेश जी का, अब इसके पास सुना दीजिएगा। एक कोई गाना था बहुत पुराना कि तुम अगर मुझको ना चाहो, ऐसा कुछ गाना था, मुझे याद नहीं आ रहा।
कोई बात नहीं।
तुम अगर मुझको न चाहो तो कोई बात नहीं, तुम किसी और को चाहोगे तो मुश्किल होगी, तुम किसी और को चाहोगे तो मुश्किल होगी। तुम अगर मुझको न चाहो तो कोई बात नहीं, तुम किसी और को चाहोगी तो मुश्किल होगी। तुम अगर मेरी नहीं हो तो पराई भी नहीं, बात तोड़ी भी नहीं, तुमने बनाई भी नहीं। ये सहारा भी बहुत है मेरे जीने के लिए, तुम अगर मेरी नहीं हो तो पराई भी नहीं। मेरे दिल को ना सराहो, मेरे दिल को ना सराहो, तो कोई बात नहीं, तो कोई बात नहीं। शहर के दिल को सराहोगी तो मुश्किल होगी, शहर के दिल को सराहोगी तो मुश्किल होगी, किसी और को चाहोगी तो मुश्किल होगी। एक मेडलेस वाले सॉन्ग, कुछ गीतों का इसमें समावेश है, glimpses of few songs. You would love to listen to many singers, बहुत में गायकों की आवाजें आएंगी। शुरुआत करता हूँ जगदीश के साथ की सुंदर सी जरूर। तुमको देखा तो ये लाया, तुमको देखा तो ये लाया, जिंदगी को तुम घना आया, तुमको देखा तो ये ख्याल आया, जिंदगी को तुम घना आया, तुमको देखा तो ये ख्याल आया। उम्र की सीमा हो न जन्म कहो, उम्र की सीमा हो न जन्म कहो बंधन, जब प्यार करे कोई तो देखे केवल मन, नई रीत चला कर तुम ये रीत अमर करो, नई रीत चला कर तुम ये रीत अमर करो। जाने बगैर तुम किसी शायर का पास हो, चौदहवीं का चांद हो या आफताब हो, जो भी हो तुम खुदा की कसम लाजवाब हो। चौदहवीं का चांद हो कभियों में जब हुई ओझलता से, अरवाई बैठे बैठे सब दुनिया के। कभियों में जब हुई ओझलता से, अरवाई बैठे बैठे सब दुनिया के। कभी मटल के प्यार से पली के, तुमने कोई मुझे पर नजर न आए, नजर न आए। कहीं दूर जब दिन कहीं आए, आज कोई बदन चलाए चुपके से आए। मेरी बेले मस्ती में खेले, तेरों से मिल के गले, मिलेगा जन्नत के तले, सच्ची का प्यार पले। ऐसे ही जग में आती है सुहें, ऐसे ही शाम ढले। ला 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 ला, ला 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 ला।
मेरे फोटो खोलो।
मुझे जीने दो, ये नयन करेगा, ये जान करे सके, जरा जीने दो, ये नयन करेगा। नजारे की मस्तियाँ लुटा लुटा के सो गए, सितारे अपनी रोशनी दिखा दिखा के सो गए। की रुत बदल चुके, ना जाने तुम कब तो बड़ी रात ढल चुके, ना जाने तुम कब आओगे। हरेक समर्पित के ना जाने तुम कब आओगे। परिस्थिति सदर देवराम विकास को किसी दोस्ता में लहर से उठी है अभी, में लहर से उठी है अभी। कोई खासा हवा चली है अभी, लहर से उठी है अभी। गरी दुनिया में जी नहीं लगता, गरी दुनिया में जी नहीं लगता, अरे दुनिया में भी नहीं लगता, किस चीज की कमी है अभी, जाने किस चीज की कमी है अभी, कोई आशा समा चली है अभी, इस लहर से उठी है अभी। वो परवाने में तो शम्मा कदम भरते हैं, हुस्न की याद में खामोश जलाते हैं, आती निकले तो ये प्यार की रुसवाई है, छोटी चोट मोहब्बत की उभरवाई है, दिल ने फिर याद किया तुम इतना जो मुस्कुरा रहे हो, तुम इतना जो मुस्कुरा रहे हो, क्या गम है जिसको छुपा रहे हो, क्या गम है जिसको छुपा रहे हो, तुम इतना जो मुस्कुरा रहे हो। आँखों में नमी हसीनों पर, आँखों में नमी हसीनों पर, क्या हाल है क्या दिखा रहे हो, क्या हाल है क्या दिखा रहे हो, क्या गम है जिसको छिपा रहे हो, तुम इतना जो मुस्कुरा रहे हो। आपके लिए विवेक जी के लिए एक शेर पेश करना चाहता हूँ। इस शहर में किससे मिले, इस शहर में किससे मिले, हमसे तो छोटी महफिलें, रिश्त तेरा नाम है, रिश्त तेरा नाम है, रिश्त दीवाना तेरा कहीं, चांदनी की रात की चर्चा तेरा कहीं, चांदनी की रात की कहीं, चांदनी की रात की कहीं, चांदनी की रात की। कहते हैं ना,
बहुत बढ़िया।
पर ये भी आप ही के लिए मेरा अशार है के दर्द होता नहीं सभी के लिए। आज बड़ा एप्रोप्रिएट है, आज से कुछ इसके अशार आज के एप्रोप्रिएट है कि दर्द होता नहीं सभी के लिए है, ये दौलत किसी किसी के लिए, आपकी मांग में सितारे हैं, हम तरसते हैं रोशनी के लिए। कैसे कितने सामान के लिए पैदा, कितने सामान के लिए पैदा, इतनी छोटी सी जिंदगी के लिए, और पहले दिन उसको दिल नहीं कहते जो घर का न हो किसी के लिए। और सबसे बेहतरीन जो शेर है, कहते हैं कि सारे वादे ही जिंदगी, सारे वादे ही जिंदगी सच हैं, कौन मरता है कुछ के लिए। और डॉक्टर विवेक के लिए जो शेर है कि क्यों जलाई शमा बुझा दीजिए, क्यों जलाई शमा बुझा दीजिए, डॉक्टर विवेक की काफी है रोशनी। और जो आप कार्य कर रहे हैं दिल से जो आप कार्य कर रहे हैं, इसमें बहुत ही महान हस्तियों को जोड़कर लोगों को अवेयर कर रहे हैं, डिस्कस कर रहे हैं, जनता की सेवा कर रहे हैं दिन रात। और मुझे बुलाकर मुझे भी यहाँ पे मौका दे रहे हैं, मैं आपका कंट्रीब्यूशन को करूँ और अपने माध्यम से स्पीच और मूवी शेयर कर सकूँ। आई एम वेरी 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 ऑनर्ड एंड इंस्पायर्ड। थैंक्स टू ऑल ऑफ यू जो भी जुड़े हैं हमारे साथ, आपके स्टूडेंट डॉक्टर, सारी जो टीम आपकी है, मैं उनका बहुत बहुत धन्यवाद करता हूँ।
थैंक यू वेरी मच, आपने मजा कर दिया। कहते हैं प्रोग्राम होता है मंसूर साहब और शोकन जी, व्हेन वी हैव ए कॉन्फ्रेंस वी हैव ए एंटरटेनिंग इवनिंग प्रोग्राम, कल्चरल प्रोग्राम, वो हो गया एक तरह से।
और मेरे को मुझे आपने ऐड किया, मैंने फोन किया तो
मैंने पहले ऐड कर लिया था आपको। आप यू मिस्ड अ लेक्चर फ्रॉम डॉक्टर ग्रेग स्टोन एंड डॉक्टर दीप्ति फ्रॉम यूएसए।
हो गया कराची में
पाया था, और ये बार आऊंगा आपकी कॉन्फ्रेंस चल रही है तो मैं दोबारा आऊंगा तैयारी के साथ आऊंगा।
मंसूर साहब फ्रॉम कराची कुछ कहना चाह रहे हैं, पाकिस्तान से कुछ कहना चाह रहे हैं, बताइए।
जी आप पर उधार हो गया कराची का विजिट, आप पर उधार हो गया कराची का विजिट।
सर एनी टाइम आई वुड लव टू, आई वुड लव टू।
हम दोनों साथ आएंगे, हम दोनों साथ आएंगे। ओके, तो फाइनल वर्ड्स फ्रॉम, यहाँ दोनों साथ चलेंगे। Final words from PK Ashokan and then we will wind off because it's already too late. And Ashokan, please summarize the whole thing, then I will say closing words. Can you hear me? Yes.
Can you hear me now?
Yes, perfect. Dr. Ashokan is a very important cardiologist from Calicut, Kerala.
Thank you for the song, the Pangaji. We all enjoyed. And we are all relaxed at the end of the webinar. So, yeah, let me thank Professor Vivek Gupta for arranging the webinar and coordinating with the eminent personalities from USA, India, and other Asian countries like Pakistan and France. And it is really a unique opportunity for all of us to learn from this experience, from these experts regarding this life-threatening pandemic. So I think we should have some more webinar like this, and we should have some guidelines, and we should summarize the things maybe in next time, because now we have opinion from the Europeans, faculty, personalities from then also from experts from the USA and India and other South Asian countries.
Next week, Shukan, we have missed out. I'll just request Mr. Uttam Rawat to come in, but before that, I would like to tell you that Continue Colombo was missed out, and Horst Sievert, who is also doing a CSI meeting, structural heart, he wanted to come in, but last minute he got cancelled because there was another meeting for him same time. And then Dr. Imash Shivan, he said he would like to come in, but then again he had another conflicting time. So we'll take three people now: Colombo, Horst Sievert from Germany, and Dr. Imash Shivan from Italy. And we might do next week with more inputs coming from Pakistan and other places, and maybe Martin Leon from TCT. So, Uttam Rawat want to say something from Paris. Please go ahead and then we'll finalize it.
फ्रांस से वो आपके उसमें ग्रुप में वेरी इंपॉर्टेंट क्वेश्चन जितेंद्र कुमार फ्रॉम फ्रांस।
बताइए, बोलिए
वही पे आपके उसमें है जितेंद्र कुमार। जितेंद्र क्वेश्चन पूछो अपना। जितेंद्र कुमार।
जितेंद्र आई थिंक not there. Okay, Jitendra, tell me. Yes, quickly.
Yeah, thank you.
Research project going on in COVID-19. So I would like to know that is there any project going on in India to assess the psychological impact of COVID-19 on the patients, doctors, and the vulnerable section of our society. I am working on one of the projects with the help of one psychologist. I am a software scientist. I would like to know a few words on it from your side.
You see, this is a new disease, and at this point of time, we are learning, and we are not only learning, but we are fighting to finish off the mortality or reduce the morbidity. I think this is a good idea to have a psychological impact, which will come soon. As of now, I don't think we know that it's a full phobia for the whole world, and how much psychological impact it will leave, that will come to know after some time, few months more. Then we can have such project, because today we are trying to find out the way to cure it, to reduce the mortality, to find a vaccine, to help for the plasma treatment, other things. But it's a good valid point, we'll take up soon. And finally, I think
I'll tell you one personal example. In France, there was one student in HEC Paris. HEC is one of the best universities in the Europe. And the student did suicide. So this situation, I understand that even the elite class, the educated people are going through psychological stress. So this is very important point from my point of view to do some research in the coming time.
I agree. I completely agree with you. Ashoka, you want to say something? Or Dr. Mansoor, you would like to say something?
Very valid points. I think we see a different population post-COVID area. When you talk about the psychological things, there are psychological stress on doctors or health workers, and psychological stress on the communities, psychological stress on the patients affected with the disease, and also psychological stress on the government. So everybody is affected, and a lot of anxieties and a lot of other factors are especially very important.
Anything from Mansoor? Mansoor, you want to say something?
Yeah, I think it may be a little too early to make too many comments in our part of the world, really. Because honestly, my worry is that we may be building up a base for a flare-up. Because data is not there, testing is not there, the facility is not there. So let's keep our fingers crossed and hope for the best. We are moving into an unknown area, really, as far as our part of the world is concerned. That in fact there was some data, somebody projected a data suggesting that if it followed the same pattern as the West, then Pakistan should end up with 50,000 mortality in another 2 months. So God forbid that may not happen, right? But the projected data is such that we may be about 2 to 3 million people may be affected. I hope we are wrong, but that's a projected data. Somebody's actually statistically projected it, keeping in mind the data available from the West is as per Dublin Times. We have already mentioned it before. So that's what we have thought, that we are different people, we have different genetics, and we may not be affected as badly from COVID as the rest of the world, or the Western world has.
My worry is different. I feel that lockdown, for example, Mr. Donald Trump, US, they are trying to finish off the lockdown soon in phased manner. Similarly, we are, because the whole economy is affected. But I agree completely with our Prime Minister, Jaan hai to jahan hai. But especially with the small time worker, it's very problematic for those who earn a bread every day. But I think lockdown should continue for a while more. My personal perspective, because that is the only way you can contain it, and contact tracing. Everybody is not doing, people are not downloading this app, but I think it should be made mandatory for the government to download this app so that we can at least find out the contacts within 14 days of those who are infected. So lockdown should continue for a while. The people in general are very much fed up with lockdown, but I completely agree with myself. I would say that maybe another 2 weeks of further, for example, the France, you said it's a crime to come out of the house. So the further lockdown, but Noida has done the best thing. You know, our Uttar Pradesh, now people cannot go from Delhi to Noida. Yesterday my brother wanted to come in. They said if you go to Delhi you cannot come back unless you have another curfew pass, which is so difficult. So I think the things are very difficult. The government is working with different tone. Unless there is a drug which can kill the virus quickly, I think we have to do something. Vaccine is taking long time. Hydroxychloroquine, I personally say, I summarize this again, it's not that toxic. So if you have a normal QTC interval, you should take it. Mansoor, have you taken hydroxychloroquine?
Yeah, we have been using.
No, not for COVID, for prevention. For prevention.
Yeah, we have been using it so frequently. I think all of us have used it all our lives, and I'm yet to see a real problem with hydroxychloroquine.
Have you taken yourself or not?
I take weekly because
Okay.
I go to the hospital. So I take
Good.
weekly.
Ashokan, have you taken Ashokan?
I started last week. I started.
But have you taken yourself or not?
Yeah. Started.
Okay, that. It's a very small dose, 400 milligram once a day. 1 day, 400 milligram twice a day, and then once a week. It's simple. So I think we should conclude this seminar. It's a webinar. It was a good. Anything left out, I would like to summarize and finish off because it's already too late. It's getting 10 p.m. in India, 9:30 p.m. in France, and Dr. Greg Stone has left. So thank you very much for joining in, and thanks support from Pakistan. Mansoor, Pankaj Jeswani, Ashokan, Dr. Greg Stone, Dr. Dipti, who just left. They had to do the case. Colombo could not come in. He called me that he will be joining in the next webinar. Horst Sievers will come. You know, he's from Germany, and then Imad Shiban and maybe somebody else. We have to keep talking about once a week, and then we have to understand more of this and before we finally win over Corona, which is, I think, a little distance away from us. Thank you very much. And I am going to end this meeting with a small thought process that our Prime Minister and your Prime Minister, and we have to keep our country safe, the Europe, the America, the whole world is one. The borders were made by our India, our people. There was no border made by the God. So we have to come together. At least one thing which good thing, two things which happened good. The world has come together. The second good thing, the planet Earth could breathe better. So this is good thing, but we don't want to take life of the innocent people. Bill Gates said it's like a world war where everybody is on one side. Our chairman, Dr. P.C. Reddy, says it's a third world war. So we don't know, but the killing is so rampant. But we have to be still thoughtful and careful, and we should follow the advice. The साथ effect, साथ जो हमारे Prime Minister Narendra Modi जी ने कहा है, and 2 P's, precaution and don't panic, and साथ take care of your elders, sanitization, healthcare workers, respect to police worker, and so many other things, and take help of it. Finally, we have to pray to God that Bhagwan bachaye और आपके अल्लाह बचाए. Thank you so much. All Jesus Christ, Guru Nanak, everybody is same. There is only one God, which is the God Almighty. We have different names, and they have to come back to earth to save us from this big pandemic. Thank you very much.
Thank you, sir. Thank you, Dr. Thank you.
Good night.
Good night. You take care of yourself. Take good care of yourself. Thank you.
Thank you very much on the Facebook Live for watching this. This was a different way of interacting with the world over leaders. Dr. Greg Stone is one of the top cardiologists from USA, New York. He was talking about his views. Mount Sinai Hospital, they had 2,200 people, COVID patient in one hospital, which was something very difficult to know, understand that New York is suffering, and they say the graph is coming down. So let us hope and pray to God that the things will be fine soon. Lockdown should continue. This is what I feel, a little more. And then once the things are absolutely normal, then we can hope for the best. The medicines, hydroxychloroquine, hand sanitization, the antiviral medicines, COVID-19 patient, contact tracing, all these things, just to revise what I spoke in the earlier part of my webinar about this deadly COVID-19 virus, coronavirus 2. Now we have to feel happy. We had a good entertainment by Pankaj Jeswani, who sang a lot of songs. It was really entertaining. Thank you very much. On 28th of April, 9:50 p.m. काफ़ी देर हो गई है आप लोगों को. भगवान का आशीर्वाद लेते हुए आप सबसे इस समय विदा लेते हैं. माता वैष्णो माता, कामाख्या माता जी और अपने सारे यहाँ के जो लोग हैं, जो पॉलिटिक्स के प्रधानमंत्री जी, हमारे बेटा डॉक्टर चिन्मय गुप्ता was also live. This time he spoke about the lockdown, and then of course everything is okay. Thank you very much. 28th April, we'll meet soon. Thank you very much. Bye bye.